Good morning, everyone, and welcome to today's meeting of the Audit and Performance Committee. Can I first introduce those who are sitting alongside me here? I'm Councillor Sheila McCall and I'm chair of this committee. To my second right is Jackie Pepper, the Chief Officer of Perth and Kinross Health and Social Care Partnership. And next to me is Donna Mitchell, the Chief Finance Officer of Perth and Kinross Health and Social Care Partnership. And to my left is Jessica Guild, who's the clerk to the committee. Can I ask Jessica to let me know if there are any apologies received?
Thank you, Chair. We don't have any formal apologies today, but I note Sandra Auld isn't present. I wonder if she's just running a couple of minutes late. I'll let you know if and when she joins.
Okay, thank you very much. And can I remind those joining virtually to use the chat box to attract my attention during the meeting? Can I ask if there are any declarations of interest in respect to the business of the agenda today? Martin?
I'm never sure if I should declare the interest because I'm also a member of the Angus IJB.
Thank you. Since there are no declarations of interest, we'll move on to the first item on the agenda, which is the minutes of the previous meeting held on the 25th of August 2025 for approval. Are there any questions or matters arising from that minute? Then can we agree the minute from that meeting on the 25th of August? Thank you, everyone. And we also have the minute of the meeting of the Audit and Performance Committee of the 29th of September for approval. No questions or issues rising? Fantastic, thank you. And now we go on to item number 3.3, which is the action points update. I would note that action number 56 is on today's agenda elsewhere. Are there any matters arising from or questions on the action?
Yeah, Aaron and I went out to the Joint Equipment Loan Service and it was a very useful introduction to what they do. So thank you for that.
Yes, I think it's been difficult to get a critical mass of attendance at that. So I think we'll try and get another session arranged as well, in addition to the one back in September. So thanks very much for going along, Councillor Aaron.
Thank you. I'm glad that was enjoyable. I would like to have gone as well, so I'm pleased that you're going to try and organise another one. So thank you very much for that. We now move on to, well, we've done the matters arising from that. So now move on to the next item on the agenda, which is the Key Strategic Performance Report for Q1. Now this is, so can I ask Chris Jolly to introduce this report? He's online. Chris is online. Okay, thank you.
Good morning, Chair. Good morning, Committee. Apologies for not being present in the chamber this morning. Thank you for giving the opportunity to provide the committee with the first quarterly performance report of 25-26. The committee will note that this report comes in an updated format to that which was previously provided. It also contains a much wider breadth of indicators which are split into older people services, adult services and primary care. This report also provides strong financial context which helps to demonstrate what has been achieved over recent years and assists us in understanding that with further population growth, increased demand for services, options for reducing expenditure are extremely limited without significantly affecting performance. This report and the change in format follows the approval of the IJB performance framework in June this year. Members will note that measures outlined within the report vary from those which were contained within the performance framework initially. This shift recognises, as does the performance framework itself, that there is a need to develop delivery plans for these large portfolio areas, and as they are developed further, relevant KPIs will emerge along with appropriate targets which set the direction for future delivery. Overall performance across the indicator set is good, although A&E attendances have increased along with emergency admissions. people are actually spending less time in hospital, and the consumption of hospital bed days is improving. Delayed discharges have continued to improve also, considering that considering DDs through an alternative lens. We can see that 98.2% of people were discharged without experiencing a delay. Levels of unmet need in terms of care at home has also improved, despite more recent variability when considering measures over the course of this year. Up to the end of June, performance is improving. In mental health, contrary to other specialities, A&E attendances have actually improved, as have the number of occupied bed days. The report also highlights the demand for services remains high, which can be seen in POA and CMHT, community mental health teams. In primary care, there are slight increases in the accessibility of community treatment and care appointments. However, did not attend rates remain an issue and are higher than would be ideal. First contact physio has seen an improvement in Q1 from 91.9% of appointment utilisation to 95.3% for the period, with the vast majority of people being new to that service, and also showing that 69.8% of them were discharged with no need for further treatment, which is a good outcome for those people. The report also contains iMatter results for this year, which shows high achievement across the staff governance standards, with scores of at least 73 achieved across each of the measures. The report contains a great deal more than this verbal summary, and so I'm happy to pause there and take questions.
Thank you, Chris. I also might take this opportunity before questions to thank officers for pulling together this report. As you'll see, this is the first time we've had information provided in this way. I have felt at previous audit and performance committees that I think with some of the financial information going to the main IJB, there was a certain paucity of scrutiny perhaps on overall performance within the service. So this is the first attempt to put together a number of key performance measures, some of which are outside the statutory reporting. So I'm hopeful that it will generate some scrutiny today. And I'm also hopeful, if you look at the recommendations, that although we're asking to approve the range of performance indicators, I'm very open to other suggestions from members of this committee as to what we can do to enhance our scrutiny performance role here. So I'll open the floor now to questions. Do anybody have questions or comments on the report, please? Heather.
Good morning. Thanks very much, Chris, for the report, and I found it really interesting. It's the first version, obviously, so I think it will be quite an organic process to develop it as you go. So my comments are quite general with regards to the report and the contents of the report. I've got some specific questions that relate to the area of mental health and learning disabilities, but my overall comment would be I thought it was providing a lot of really useful information, but in a number of places it mentions progress as being has remained largely stable, and I think using that term really can hide issues in particular areas and particular localities. I think in some areas, Chris, you've pulled out that the issues really are around Perth City, but it would be good to know what underpins the concerns that are being raised in the report or the challenges that are being raised in the report, because I think if we just see has remained largely stable, well, what are we doing about it? Because we really want to improve it in some way. So I would like a bit more narrative about the actions we're taking, perhaps, as opposed to just a description that says it's remaining stable, because remaining stable, I have a concern if everything just remains stable, because what are we doing to try to improve that? So that would be my overall, if you like, comment. I certainly thought it gave us a lot of useful information, but could have been extended slightly to say a bit more about the actions. And then the section that I thought was really interesting for me anyway, because of the role I have in NHS Tayside, was the services for adults and the transformation of those services. And I think that's going to be key as we move forward. And again, because of the financial challenges in this area and the transformation of services, I think it would be helpful to see a bit more about how we're going to manage that aspect of it, because it isn't clear in the report. You do mention that there are financial challenges, Chris, but it doesn't really go into it. And when we talk about services with people with a learning disability and the increase in demand, the need and complexity and high costs, I think we understand all of that. But it's that whole transformation agenda, and I suppose we'll know more when we see the final strategy and the model of care for adult mental health and across Tayside. So I do know that that's all in development, but I would like to see that reflected in this report as we go forward, so that we are challenging on the actual key performance indicators that we will need to have in that particular area. But as I said at the start, I think it's a really good place to start. It will be an organic report and it will develop as we go along, but I found it really helpful in giving an overview of all of the different areas. So thank you very much.
Happy to comment, Chair.
Yes, Chris, please do.
Thanks very much, Heather. Yeah, I think you've raised some very good points. On the two sort of substantive points that you've made, the first about effectively what we're doing about it. I think what we've tried to say in the report is that we recognise that there are delivery plans being developed in respect to each of those large portfolio areas in older people, adult services and primary care. So it's about how we develop the report as we move forward to reflect what's being set out within those delivery plans, and as that detail emerges, there'll be a better opportunity to answer your question more fully, or to populate the report more fully. I think in respect to the specific point on adult services, I might refer to Jane on that. I know that there was a recent report to the IJB where recent developments in adult services were considered.
Thank you, Chris. Jane, do you want to come in?
Thank you, Chair. Yes, I'd be very much in agreement with your observations, and just to provide a reassurance that those actions are being taken. So there's a number of work streams. One is to clarify exactly what it is we were doing, what it is we're trying to achieve, and most appropriately to measure our progress against that. So we've had recent workshops looking at specific indicators that would be more meaningful for ourselves and yourselves in trying to understand the progress or otherwise that we make. We also now have clear plans in place, which means that our governance in terms of making sure that that progress is achieved is also there. So really happy to provide more information in the next report, and very much appreciate your point.
Thank you to both Chris and Jane for replying to those comments. As I said in my own introduction, this is a new report, and this is an audit and scrutiny committee and looking at performance. So I think those comments are helpful, but the responses are equally helpful. And you're absolutely right, Heather. This will take some time to evolve into something that's perhaps more meaningful. And my own personal hope and ambition is that we're looking forward more than necessarily looking backwards. Those of you who know me on other committees know it's a mantra of mine that we spend far too much time looking backwards and not enough time looking forwards as to what we hope to achieve and what our ambitions are. So thank you both. Jackie, you would like to come in?
Yeah, it's really just to say thank you very much for the helpful comments and steering this. And I think one of the recommendations is to ensure that we set targets. So that's about, so what are we doing about it? So good enough is not good enough. We want to be better than that. So what ambition are we setting here, and then how are we going to get there? Because it does strike me that there is perhaps more detail in some of these indicators that we're providing to NHST Side Board through its performance report than is coming to this committee. So I think we need to address some of that as well. So I think these are really helpful steer to all of us in terms of preparation for this, and we'll take that on board. But there's what I think this report for the first time to this committee sets a story and the interrelatedness across the different indicators that we're reporting on and how important they are to each other. And I think that's for the first time that you can actually see that in one place. So hopefully that's been helpful too. Thanks.
Thank you, Jackie. Heather, you said just some questions as well, but can I come back to you? Because I think Martin has some questions.
It was just to say that in areas where the report is indicating that we're doing really well, I think that's positive, and we need to be able to pull those areas out. But my question is really, how are we learning lessons from the areas that we see that are doing well and making that transition to other areas? Because there may be good practice that we can transition. And I know that we're doing a lot at looking outside Perth and Kinross to see what's happening so that we can learn from that. And it was great to read that and to understand that that's happening. So I suppose it's about the lessons learned from what we're doing inside Perth and Kinross that's working well, and how we can help to support other services that maybe aren't working so well to improve by learning from each other as well as from outside Perth and Kinross. So I know there's a lot of work going on in that area, and I would just ask that we get some feedback on that as we move forward with this report, because it's good to know that we are learning from each other and taking that on board. So just a comment, an observation. Thanks.
Thank you, Heather. Okay, thank you. Martin?
Thanks, Chair, and thanks, Chris. A really good report and a lot of positives in it, but there's some issues for me. In the chart 5, it says people who admitted to hospital as an emergency without attending A&E. So where's that recorded? And does that skew other charts because of being admitted straight in as an emergency? That would be my first question. I've got another two.
You have to answer that, first of all. Just come in, Chair.
Chris, carry on.
Yeah, so the data in respect to people being admitted is all recorded within the one track care system. So it's not about charts being skewed one way or the other. What we've done here for the first time is actually separate out so you can actually see a little bit more of the detail. So no, it's just showing two different routes to being admitted in an emergency. And if you actually if we look at the charts themselves, charts 4 and 5, they actually track a really similar pattern, and indicating that the behaviour is largely similar. So it's about either people being admitted through that A&E or directly to a ward area, but the trend is very, very similar indeed. So no, I can give you assurance that one isn't skewing the other. They're just two different ways of viewing the route through which people are being admitted.
Yeah, there are a couple of questions, and on chart 22, it's talking about mental health, and what are we defining as mental health? But again, because it's talking about general psychiatry, and mental health to me encompasses much more than just psychiatry. So is there categories for the mental health that are coming in there?
So I would revert to Jane for the detail, but in terms of what range of services the CMHT services provide, but that's service orientated as opposed to condition orientated. But I'd revert to Jane in terms of the detail.
The services that are involved within these particular measures are solely mental health services. So these are individuals who have some form of mental health concern or a mental illness that comes into contact with our services. I don't think they are in terms of these measures. I don't know how Chris has categorised it. Within NHS Tayside, the term mental health can often be an umbrella term for mental health, learning disabilities and substance use. But I understand that the way this measure has been pulled together is specifically mental health. Sorry?
Where are we recording substance use?
Substance use is not in this particular report, but we do have the same measures and activity that we monitor against that.
But that to me is then separating again, and I keep going on about, say, people with mental health and substance use. If you identify and treat one, it usually helps the other. It helps the other, and if you're not categorising substance use within mental health, then that's a disservice, I believe, to the substance use community.
Yes, I agree completely. There's a significant redesign programme taking place at the moment to ensure the needs of people with coexisting mental health and substance use issues will come together in a single service. This is specifically about our reporting, but your point is taken in terms of it would be good to see them side by side moving forward.
Last question, they do not attend, and it's increasing. And what is not telling me why it's increasing, and I think there needs to be some research on that. And I've raised this before. A lot of people do not attend, but because they get given leaflets or things, they can't read and write. They cannot read and write, and we're trying to fire media and leaflets to them. And the embarrassment of saying I can't read and write is I'll just not attend. And I've raised this at NHS Tayside as well about when people phone up for appointments, when they're given an appointment, and then they'll check that they're going to attend the appointments, and people say yes, I'm going to attend, but then they didn't give them the offer of some greeter meeting them and taking them to the appointment. And I think you might find that when we address the literacy, which is over 30%, the literacy issue in Britain, that's over 30%, that then I think we'll start to reduce the do not attend.
Thank you, Martin. Sandra.
My question is in relation to page 28, and it talks about services for adults, but particularly the section under older people, and you know, it clearly says about the intense challenges with older people and their level of frailty and cognitive deterioration. I was concerned about the part where it refers to it's difficult to support these people back from hospital into the community, as care home placements for those with such complex needs are hard to find. And thinking about, I think we've got a new 70-bed care home opening up within Perth. But also it's the impact that would have on families and carers. It does say that there are discussions underway with Tayside partners to consider economies of scale do we know what that is, or what's the intention? Thank you.
Who would like to
Chair, I
say?
would revert to Jane and or Zoe for that.
Hi there. Okay, so an area where there is particular challenge, or where people sit within the service that we call psychiatry of old age. So these are individuals who can present with very high levels of need, which are really quite complex. One of the issues that we have is their needs go beyond the sort of realms of what you would call easily accessible care homes. So what we need to be really careful about is that if we support people into these placements, that the placement is indeed sustainable. So there are a number of actions we're taking at the moment. One is looking at how we could further support care homes to make sure that they can provide ongoing support in the way that we need, and also looking at how we can shape care home provision moving forward to reflect the needs of our changing population. Alongside that, we're also looking at how we design our services to try and prevent people from being admitted in the first place, so that this causes the difficulty. So yeah, multifaceted, but it's an active piece of work for us at the moment.
Thank you, Jane. Heather, do you have a question to another question?
I just wanted to ask a question and mention the iMatter report, because I think it's good to see the positive outcomes in the iMatter report. And, you know, I've had this discussion elsewhere. I think the completion rates are quite high in comparison to questionnaires in other public sector bodies. So I think that's good. There's always work to do, but I think it's good to see that, and good to see the weighted index value that's given across a whole range of indicators, and that's really positive. But my question really relates to the paragraph before 3.12, which is about staff absence. And obviously the well-being of staff is really important for us to deliver the services that we want to deliver. And it talks about work-related stress being a very small number within the percentage of staff absence, and that there are measures in place to support those members of staff to return to work. But if that's a very small number, what are we doing about the other part of that 8%? And it seems to me that it would be good to have a wee bit more information there. Thanks.
Yeah, no, happy to respond. And I think we saw in terms of looking back, because we look at this quite regularly. In fact, every month we look at the data. And in terms of staff absence, you can see there are particular hotspots. So we're actually targeting and hotspots in terms of particular teams or particular areas of service. But I think what this information in here, I think, is giving an indication if that just very slight increase is a cause for concern. And I think we really need to be really on top of that and understanding what's behind that. Because if you look at this whole report and the level of activity that underpins it, I think it's giving an indication that our workforce is pretty stretched. So our support for wellbeing is really important, and we've got a multi-professional steering group supporting that. But so we're seeing increases there. Both from health and in the local authority. So I think it's an indication of the complexity and the challenges that people are experiencing. So that will be built into our workforce plan over the next 3 years in terms of how we will be supporting the whole workforce. Thank you, Hannah.
I just come back, Chair. Just to say, I think that's really important that we understand that, because I can see from the level of work that's been undertaken, there are capacity issues. Absolutely, there are capacity issues, but the capacity issues get worse if we don't look after the well-being of our staff. So it's really important that we have measures in place, and I feel assured by what you've said, Jackie, that that's happening. And obviously we'd want to support staff as much as possible, but going to that next granular level down and identifying where the hotspots might be, and focusing on that, if it's about leadership or if it's, you know, capacity within the team or skills or whatever, is really, it's key to improving that whole agenda of health and well-being of our staff, which is critically important to deliver the scale of transformation we're trying to deliver. So thanks for that.
Thank you both. Sandra, I think you're online. You've got a question, Sandra?
Yeah, thank you very much. Just more a comment, and thanks to Chris for presenting that really informative report. Where, I suppose it's a suggestion, where we're making recommendations or making statements about improvement or not regarding services, should there be already parameters set so that we can make so a decision can be made whether this has improved or not, using either, well, preferably quantitative or qualitative data, but those comments should be evidenced and substantiated. Otherwise, they really are just the opinion of the author. And thinking back to Friday, where the presentation we had during the development session presented some really interesting data, which I'm sure could be interrogated further to give some really helpful insights into presentation. We were talking about A&E presentation and bed stay days, but also presentation at in the GP hubs. As I say, I think that some of that data could be interrogated further to give us some really helpful insights moving forward. Thank you.
Thank you, Sandra. Does anyone want to comment on that, Jackie?
Happy to comment, Chair.
Or Chris?
So just initially, yeah, I think there's been some conversation today around target setting. So thanks for your comments on overall about the breadth of the report. But up to this point, well, there's two things. One is there are certain indicators where down is good and others where up is good. So we've tried to retain a narrative that explains that and points that out, that when something's improving, it's improving, and we should comment upon that. And that's the extent to which we've got at this point. However, recognising how much that improvement actually is in relation to what the work that we've done, the actions that have been taken, and how that is then trending towards a particular level that we would want to get to, I think is where that target setting then comes in. So we don't have those targets in place yet, but we're looking to develop those, and I think we've got a good opportunity over the coming reporting period to and throughout this year to put those in place and get us to a point where we're able to make more substantial comment about the extent to which we've achieved what we've set out to achieve.
Thank you, Chris. Jackie?
Thank you, Sandra. You make it a really important point. And for those who weren't at the development session on Friday, there was a development session. I think you're referring mainly to the out of hours GP reform work that's commencing. And some of the question, you asked a question earlier, Martin, around accident and emergency presentations and admissions, and that it's really important to understand that full picture. So I think that's something we can take away as a suggestion, Sandra, because we really need to see the impact of all of that work across our communities in terms of what does that mean, because I think our numbers of A&E presentations actually is a concern for me, because we're above Angus and we're above Scotland, and it's something I think we need to address. What does that mean and why is that occurring? And I think that's not just for the Health and Social Care Partnership, I think it's for wider system partners too, but it's something I think we need to bring back in terms of what is it we're doing and what's the intended impact of that. Thank you.
Thank you, Jackie. David, you have a comment you wish to make?
Can I ask a question and a comment? The comment is about staff engagement, and you're seeing absences rise. Do we have any information on staff turnover? That's another key variable of staff engagement.
I don't have that to hand, Councillor Elmer, but it's something that we can look to investigate.
I don't have that information to hand either, but I think that's something we can provide separately, but we can bring that back in the next performance report, because I think it's really important to understand, because there'll be areas where we have actually very little staff turnover, but there are other areas where we'll see that, and it's probably linked to sickness and complexity and high pressured environments as well. So I think that if we can bring some data to allow you to understand that picture, I think that would be helpful. Thanks.
Thanks, Jackie. David, do you have a question as well? Do you have another question or comment?
And we've got the staff engagement survey coming up, and hopefully as many staff and managers will encourage as many staff as possible to complete that.
Thank you, Councillor Illingworth. I think you're referring to the staff engagement survey, which is for council staff. And we wouldn't want to stop people taking part in that. But one of the things that we do have with iMatter is, which takes place earlier in the year, it's across the whole of the Health and Social Care Partnership, and we've got the trends over, I think it's about 6-7 years now, or even more. So we do have an issue in trying to ensure we've got as higher response rate as possible. So the more you survey people, the less likely they are to take part in the future. So we just have to get the balance right in that. Thanks.
Thank you, everyone. I don't see any. Oh, David, do you have something else you want to say? And Margaret.
Can I make a comment? Yeah, it's a general comment about the report. There's lots of good news stories in there, and obviously we want to do better than stable, but given the increase in demand, stable is actually not too bad. So let's not give ourselves such a hard time. So okay, thank you for that.
Martin, you have a.
Quite a lot has been said of the question I was going to ask, that we need to start recording the impact of the initiatives we've taken and the positive outcomes from that. But just when Jackie mentioned about the what we're good at, and staff are there's not much of turnover. Where staff are turning over, if we start to recognise where that is, then there could be mitigations put in to try to alleviate that pressure on the staff. So that would be good if it was recorded.
Thank you, Martin. I don't see any other questions. Before we move on and go to the recommendations, I would just like to again thank staff for pulling this together, and I'm really encouraged by the amount of questions that are really helpful. I think, as David said, we do a lot of good things here and we don't often focus in on that. And so I think that this report gives us a balance of both. There's a number of really good suggestions coming forward. So as Chair, I work with officers to see how we can help inform this report better. But if there are other suggestions from members of this committee, please bring them to Chris and by all means copy me in on them. Because I think the more we can make this a living working document that helps us look forward, as well as recognise what's worked well and what hasn't worked well, then I think the more effective this particular committee will be going forward in the future. There's a couple of things in particular I would like to maybe comment on. I want to pick up on Martin's point about A&E attendance, particularly at PRI. I probably should declare that I'm also a member of the NHS Tayside Performance and Resource Committee, so I do understand about some of the ways things are reported differently. But the issue about A&E in Perth and Kinross, or in PRI in particular, we don't have information about how many people are not admitted to PRI, but perhaps are transferred to Nine Wells. I think that would be useful to know. I think it would also be interesting to know of those people who do not need to be admitted, whether or not they'd contacted the NHS 24 service in the first place and what that performance was like. Because I think if that, I don't think many people understand that is meant to be their first point of call. So I think there's some other areas in there. I totally 100% agree with Jane and with Martin that substance use and mental health cannot and should not be separated out. So hopefully that will come. On did not attend, this is one of my favourite topics, again in the Performance and Resources Committee. I have multiple reasons why I think this happens, not least of which is how people are contacted. And literacy is one issue. The other issue might be that people get text reminders, but it doesn't actually tell you where you're supposed to be going. It just says you have an appointment at Outpatients. And if you've mislaid your letter or it hasn't arrived or something like that, then you have no idea where it is. So I think some work around that would be really helpful. And also to understand perhaps what areas, what clinical area has the biggest percentage of do not attends. Because apart from, you know, being a time and resource impact on staff, it also may have an impact on patients who perhaps need support and they're missing out on it. I have a small question about staff absence. I know that in Perth and Kinross Council we have an employee joint consultative committee for staff that are employed by Perth and Kinross, and although we have the Health and Social Care Partnership staff as an entirety, I just wonder what representation, if any, we have in that particular committee for the social care staff that are employed by Perth and Kinross, and whatever the similar equivalent is in NHS Tayside. Let me see if we get anything else on here. Sandra, I totally agree about the statement about other parameters being included. I think they're really important, and I think that stable isn't too bad, but we can do better. I totally agree with that too. So I want to thank everybody very much for your engagement in this report. And as Heather said at the beginning, it's a living document and it will evolve. And so I look forward to getting some other feedback from you before the next committee. We can help structure this so it's a proper scrutiny report for this committee. So I will now move on to the recommendations. The Audit Performance Committee is asked to scrutinise strategic performance in relation to the delivery of integrated health and social care services, to approve the range of performance indicators included for future reporting, and request that the Health and Social Care Partnership develop targets for key performance indicators ahead of the next report. So some of the comments have been encapsulated in this part here. So is everybody happy with those recommendations? Thank you very much indeed. Okay, so now we move on to the governance assurance part of the report and the partnership improvement plan update. And can I ask Phil Gerard to present that report?
Thank you, Chair. Good morning, everyone. This report provides the regular update on the progress made with the actions outlined in the Partnership Improvement Plan. So since we last brought it to committee in August this year, we have completed one audit assignment, which was the External Audit Annual Report for 24-25. This was approved here at committee at the meeting September 29th. This resulted in one new improvement action, which is included in the plan today. It's IP 106. This is at a green status. There was one action marked as complete in the previous August report here. That's now been removed from the plan and archived. The Partnership Improvement Plan now contains 18 outstanding actions, 15 of which are marked at a green status. These all have various completion dates up until the end of the financial year 2025-26. Capacity issues have caused a delay in the expected progress with the 3 premises and property internal audit recommendations. Their status has been downgraded from green to amber. The completion date for these actions has been extended to February 2026, which will align with the next Audit and Performance Committee meeting, where we hope to bring them back as completed. Progress continues on the other actions within the PIP. We don't anticipate any barriers to meeting these deadlines. We will continue to provide regular updates on the PIP back to this committee at each meeting. And the recommendation is that the Audit and Performance Committee note the progress made towards achieving the actions outlined in the Partnership Improvement Plan. Happy to take any questions.
Thank you, Phil. Do we have any questions on this report from Phil? Martin, do you have a question? No? Oh. Okay. Well, in that case, thank you, Phil, for presenting this report. And can we move on to the recommendation? It's recommended the Audit and Performance Committee note the progress made towards achieving the actions outlined in the Partnership Improvement Plan. Have you agreed with that? Thank you very much. So now we move on to the Internal Audit Progress Report. And can I ask Jackie Clark to present the report, please?
Thank you. This report presents the progress of internal audit with the plan and other related activity, and the committee is asked to note the progress. It's relatively self-explanatory. What I'd like to draw your attention to is that the lead partner audit assignment brief has now been shared with us, and we're working to jointly commence that piece of work with other IJB internal audit teams. That is an assignment which is being led by a different chief internal auditor. I'd also like to draw your attention to a couple of other additional pieces of work that internal audit have been involved with. The first is referred to as an audit which is included within Perth and Kinross Council's internal audit plan on the financial administration of a HSCP establishment. That piece of work is substantially completed, and the draft report is circulated, and it's due to be considered by hopefully the next meeting of the Perth and Kinross Council's Audit and Risk Committee, following which I will ensure that this committee is made available of the contents. And the second is also related to a whistleblowing disclosure, which was received through Perth and Kinross Council's whistleblowing procedures, but is relevant to the HSCP. Internal Audit has worked alongside the service who have led with that, and there are no issues relating to internal control or governance arising from that, so no separate report will be presented to this committee, but I wanted you to be aware that Internal Audit have been involved with supporting the service in these areas as well. And then you'll see the next item on the agenda is the proposed strategy and plan for internal audit, but we'll come on to that report when we get there. I'm happy to take any questions or comments. Thank you.
Thank you, Jackie. Martin, you have a question?
You mentioned the whistleblowing going to Perth Council, but obviously the partnership is between Perth Council and NHS Tayside. So how does that link to the whistleblowing in NHS Tayside?
Jackie, do you want to?
Thank you for the question. Once the report has been finalised and shared with Perth and Kinross Council's Audit and Risk Committee, as part of that process, I will be sharing the outcomes with the high-level outcomes with my colleagues in NHS Tayside Internal Audit for their information. But it is very much based around the financial administration, which is undertaken by council staff. And hence the reason it's council. But I will be able to share in confidence the outcomes with my colleagues, and obviously with yourselves, as I've stated. Thank you.
Thank you, Jackie. Does that answer your question, Martin? You don't look very sure.
Yeah, the health and social care partnership, and if there's one aspect impacting on the health and social care partnership, I just find that it's just maybe my age, and I just didn't see the fact that there's two whistleblowing champions. So you could tell one whistleblowing champion that we've got a problem that will impact on the health and social care partnership, or could impact the health and social care partnership, but you've got another whistleblowing champion that knows nothing about
it. I see. I do understand that it is quite complex, the whistleblowing policies were recently realigned to support each other. This area is very specifically within the council's remit rather than that of NHS remit. The whistleblowing was very much that way. So it won't have any impact on health delivery, but it will be coming here because after it's gone to the Audit and Risk Committee. It will be coming to members of this committee for information, and really at that point you'll be able to probably understand it better once you see that report. I hope that helps a little bit. Thank you.
Thank you both. I have some sympathy actually with Martin's point there, Jackie, and it's maybe something we just need to look at about the whole whistleblowing process, because I think, the Health and Social Care Partnership is one organisation, albeit the combination of two different partners. And I take your point that even just for awareness, it's worthwhile perhaps the other knowing. So maybe we can take that away and have a look at that and to consider how we do that. Heather, you would like to come in?
Can I just declare an interest, because I am an NHS Tayside's whistleblowing champion. Just to say, this has been reported through NHS Tayside Staff Governance Committee, and the concern has been logged. Obviously, we don't have the final conclusions to that. However, I would just say that it has gone through proper governance processes so that NHS Tayside is aware. That's all I could say.
Thank you, Heather. Martin, does that give you some comfort?
Perth Council's aware, NHS Tayside's aware, and the Health and Social Care Partnership's still whistling in the wind.
I'm not quite sure what you mean by that, to be honest. I think the whistleblowing, Heather might help me more with this, but the whistleblowing process really has to be undertaken in confidence. And that's my understanding of it. And at some point it will be opened up once perhaps it's concluded. If there's an outcome that needs to be shared, it will be shared. But sometimes, I'm sure you're aware, Martin, there's some whistleblowing initiations that perhaps are unfounded, perhaps, and in which case then is it? We just need to have a think about that. But Heather, maybe you can explain more.
What I would say, Martin, is that the Staff Governance Committee looks at any whistleblowing issues or concerns that are raised from any health and social care partnership, and what we do is report that through staff governance. So there's a tracker through staff governance that reports on any whistleblowing concerns that are raised. It provides the outcome of those whistleblowing concerns, and that's shared, and then the Health and Social Care Partnership, from a governance point of view, has to report back to the whistleblowing review group in NHS Tayside with a report 6 months after the concern, to make sure that all the actions that have been identified have been implemented. So from a governance perspective, I think we have got it covered, and what I would suggest is that once the process is complete, then there's probably an update that we would bring to this committee. But we're in the middle of a process at the moment.
Thank you, Heather. I think, it's clear there's a fairly clear and prescriptive process within NHS Tayside, and I'm pretty confident there's a similar process within Perth and Kinross Council. So I think probably what this committee and what I'm hearing is we probably need to make sure that A, they're aligned, and B, that they come forward to the right IJB committee, whether it's this one or the full committee, to report. So perhaps when this process is concluded, we'll take the opportunity to just satisfy everybody on this committee that we have that processes work in parallel with each other, and that they align and communicate with each other, throughout the whole process. That help, Martin, if we come back with that.
I'll just take my confusion, because if it's went to staff governance, it went to board level. Because if it's no went to board level, it's lying in staff governance, Like the Perth and Kinross Audit and Risk, have they taken it to council? So where's the line?
Jackie, can you come in here just for a minute, please?
I've now forgotten what I was going to say, but I suppose in this, we're talking about two different things. We're not talking about the same thing. But what's reassuring, I think, for this committee is that despite the conflict of interest, Heather, that you as the whistleblowing champion know what we're talking about, and that Jackie as the whistleblowing point of contact for the council knows what we're talking about in terms of these two instances. And that's the important thing, I think, to take away from today, and that process is underway. Thanks. I hope that helps.
Does. Thank you. Personally, I've never known a whistleblowing issue to come to full council.
No, the whistleblowing disclosure outcomes will come to the Audit and Risk Committee, and potentially, depending on the nature, to the Scrutiny and Performance Committee, but it wouldn't automatically go to full council. Thanks.
Thank you, Jackie. And in fact, we have David here, who do you have any comment to make on this, David, as the chair of the Audit and Risk Committee?
I'm content with the way that whistleblowing is handled within the council.
Okay, thank you, everyone. That's probably more than I expected from this particular report, Jackie. But nevertheless, I'm very pleased to have the questions. So can we move now to agree the recommendations and the recommendations in the report? The recommendation in the report is that we note the progress made in the delivery of the 2024-25 internal audit plan. That's so noted. Thank you very much. And now we move on to item 5.3 on the agenda, which is the internal audit strategy and plan for 2025-26. And I'll hand back to Jackie again. Thank you, Jackie.
Thank you. Yes, this report presents the internal audit strategy and plan for the delivery of internal audit services to the IJB, and the committee is asked to approve the strategy and plan for 2025-2026. The global internal audit standards in the UK public sector require the Chief Audit Executive, which is in this case is myself as Chief Auditor, to create a plan of work annually, and this report fulfills the requirement. As the IJB's appointed auditor, I've worked with colleagues in NHS internal audit and within the partnership to arrive at a deliverable plan in year. I've already highlighted the unplanned work that we've been involved with, which has taken place outside the dedicated time and resource which we have for the IJB within our joint internal audit plans. The approach that's presented here is to provide planned activity around key risks to the IJB achieving its objectives. A mapping exercise was undertaken regarding coverage across the councils and also within NHS Tayside. And of the 6 strategic risks which were considered at the last meeting of the Audit and Performance Committee, the additional assignment proposed is to ensure that the performance framework continues to meet business needs, to provide that assurance to this committee around the information with which they're provided. This plan, alongside delivering on the lead partnerships services and also the review of governance self-assessments which take place within the IJB, will form the planned work for within 2025-26, which should be deliverable within the current resources that are available to me from Perth and Kinross Council and also from NHS colleagues. I'm happy to take any questions at this point. Thank you.
Thank you, Jackie. Do we have any questions for Jackie on this report? Don't see any online. Okay then, well, thank you, Jackie, for the report. And can we agree to the recommendation? The Audit and Performance Committee is asked to approve the internal audit strategy and plan for 2025-26. Are we agreed? Thank you very much, everyone. So now we move on to clinical and care governance. And can I ask Aaron Singh, the Strategic Lead for Children, Families and Justice, to present the report? Thank you, Aaron.
Thank you, Chair. So the report, that is covered before committee now, in part, is also covered in the next agenda item 6.2. So I'll try and avoid duplication. So the report before committee specifically looks at the activity of the forum and reporting between the 1st of July this year and the 31st of August of this year. Committee will be aware that the forum provides assurance on the quality, safety and effectiveness of all services delegated to Perth and Kinross IJB. In addition to reporting to this committee, the Care and Professional Governance also reports to NHS Tayside Clinical Governance Committee and the Council's Scrutiny and Performance Committee, and hosted services across the 3 IJBs are reported directly to the NHS Tayside Clinical Governance Committee. So the report notes that there were 3 meetings that were held during this reporting period on the 4th of July, the 1st of August and the 29th of August, with annual reports from the Podiatrist Service, North Locality and Psychiatry for Old Age Inpatient Services at Murray Royal, and Medicine for the Elderly and Allied Health Professionals at PRI, which were reviewed along with the exception reports that are noted in the content of the report. Appendix 1 provides the committee with a report that was submitted to NHS Tayside's Clinical Governance Committee on the 7th of August, which was heard and accepted reasonable assurance that had been agreed by the nurse and medical directors. I'm happy to take any questions, Chair.
Thank you, Aaron. Does anyone have any questions for Aaron? Martin?
Page 67 on 4.5. Just could you expand what a mental health officer is?
Yes, a mental health officer is a social worker who's received enhanced training to undertake the duties associated with the mental health requirements. So detention of individuals along with consultant psychiatrists. So yeah, it's a higher status roles and responsibilities that social workers hold.
Does that include substance use?
So mental health officers are normally specifically looking at issues around kind of guardianship or adults with incapacity or detention. Clearly substance misuse might influence some of those presentations that those client groups might have, but it's not in itself working for substance misuse.
Thank you, Aaron. Are there any other questions? Thank you. I think this has been really helpful, and I think along with the strategic report we did earlier in terms of performance, there may be some. I'll come to Sandra in a minute. There may be some aspects in here in terms of assurance that we might be able to incorporate. Maybe if you can work with Chris on that, and we'll see, because I think there's some key performance indicators around this, even if it's just for assurance and gives us a bit more granularity behind it, that might be helpful. Thank you. Sandra, you have
a question belatedly. Sorry, I couldn't.
That's okay.
I couldn't indicate. So 2.4 in the report. So thank you very much for the report in general. It's noted about where responsibility lies for inpatient mental health and learning disability services. I just wanted to ask what, if any, responsibility this committee has regarding mental health and learning disability services, and just where that sits. I'm thinking of some of the feedback we've had, the IJB has had in the past regarding Strathmartin, and I have been conscious that we haven't really had an update in quite a long time around what's happening at Strathmartin, and just when learning disabilities mentioned within that report, I'd just be keen to understand if any, does this committee have any responsibility regarding learning disability services? Thank you.
I think we need to be quite clear. This is a performance and audit committee. I think the overall responsibility for the wider service is reported to IJB, but I'm sure Jackie Pepper will correct me if I'm wrong. And the reason I mentioned to Aaron earlier on around some of the key performance indicators coming here, that's the sort of things that I think we should be seeing here at this committee, so that we have the opportunity to see if the performance is meeting the levels that we expect, but also to make sure that there is scrutiny of those performances. But I'm more than happy for Aaron and or Jackie to come in and clarify that.
Thank you very much, Chair. I'll start and others may want to come in, but there's an important distinction in terms of inpatient services, that the operational responsibility is not sitting with this committee or any of the IJBs, and the progress to ensure the transfer is maybe not the right word, transition and relocation of services from Strathmartin and elsewhere to Murray Royal is reported on a quarterly basis for information to the Perth and Kinross IJB and the other IJBs. So I think it's important to recognise that. And I think there should be a further quarterly update in December coming forward. And within NHST side, that's reports to the Clinical Governance Committee. While this report sets out the arrangements that are currently in place, InTrain is a piece of work to bring together all of the clinical and care governance arrangements for mental health and learning disabilities services across Tayside, so that is reporting in the right way to Clinical Governance Committee within NHS Tayside. So that I think has been finalised and approved by the Clinical Governance Committee, but is still to be come through in terms of its first reporting. So there are some changes afoot in relation to that. I can provide you with more information, and perhaps I can give you the report that sits behind that. Sandra, thanks.
Sandra, excuse me, Sandra, does that answer your question?
Yeah, thank you very much. And that would be really helpful, Jackie, thank you. And apologies for any of my lack of understanding of arrangements for this. Thank you.
Nothing to apologise for. That's why we're here, to be asked questions, and so we can answer them and help improve understanding and improve transparency and visibility of what's actually going on, so we all have a good understanding of it. So so I don't see any other questions. Oh, Heather?
Thanks very much for the report, and I think it's really helpful, particularly with the performance report we saw earlier today, because I think it's going back to your point. There's an opportunity here for collaboration, I think, with Chris, because one of the things that was of interest to me when I was reading this was with regards to new risks and exemption reporting that was being undertaken, and then I wondered how that was then feeding into the performance reporting that we had earlier. So I think that's something that might be worth having a discussion about, because we don't get in detail about the new risks. That's done at the level of the meetings that are being noted, but I think there would be some benefit from having that cross fertilisation, if you like, of the information that's coming forward, and it would just help to ensure that we're understanding any critical risks that are coming through from the other reporting mechanisms. Thanks.
Couldn't agree more, Heather. If we don't see all of the aspects and how they interwork with each other, then we're not able to provide the function of this committee effectively, I don't think, in terms of its performance and scrutiny role. Okay, thank you very much indeed. There are a lot of recommendations to this report. It was quite small, so I shall go through them quite quickly. The Audit and Performance Committee is asked to note the responsibilities of Perth and Kinross Integrated Joint Board in respect of clinical care and professional governance, and those of the IJB partners. To note the arrangements in place for providing the IJB with assurance that effective and robust systems of clinical care and professional governance are in place. Note that NHS Tayside's Clinical Governance Committee on the 7th of August 2025 received a summary of the Perth and Kinross Health and Social Care Partnership Assurance Report regarding clinical and care governance, which is in Appendix 1 of this report, and heard that reasonable assurance had been agreed by the nurse and medical doctors and the NHS Tayside Clinical Governance Quality and Assurance Meeting. Note that there have been no meetings of Perth and Kinross Council Scrutiny and Performance Committee during the time period of this report. Note that the Chief Officer confirms the effectiveness of the above systems in place in the IJB's partner organisations, and note the assurance provided by NHS Tayside's Clinical Governance Committee. Are these recommendations duly noted? Thank you very much indeed. Well, we now move on to item 7. I think that's the last one, is it? 6.2, my apologies. The annual assurance statement, and Aaron, that's you again.
Thank you, Chair. So the report before committee today was specifically requested at the last meeting and provides committee with an annual assurance statement in respect of the work of the Care and Professional Governance Forum. So the report provides details of the annual assurance framework that all services cover as part of their reporting. Section 2.11 of the report provides details of all annual reports received from September 2024 until August 2025 and the level of assurance provided. As noted, where level of assurance was limited, this was down to limited information available at the point of reporting, which service leads subsequently provided in their exception reporting schedule. Under section 3 of the report, risk management is noted and how 6 red risks have been reviewed out with the Care and Professional Governance Forum to allow for fuller discussions with lead officers, and where appropriate, the clinical director or myself can table these risks with the Health and Social Care Management senior management team for fuller discussion. The remainder of the report illustrates the different areas of oversight that the forum takes in relation to local adverse event reviews, to significant adverse event reviews. Complaints received by health and adult social work teams are also reviewed on a monthly basis to determine any emerging themes. And finally, input from the Adult Protection Interagency Lead Officer in respect of any ongoing protection activity. So this report provides committee with a reasonable level of assurance from both the authors of the report and Chief Officer. Happy to take any questions, Chair.
Thank you, Aaron. Are there any questions for Aaron on this report? Or any comments? Martin? Thank you.
In Appendix 1 on 6.2, we have prison healthcare, no reports moved to later than a year. April, no reports moved to later than a year. May, have we got a report?
Yeah, so sorry. So what you've got here is a bit of it's a living document, I suppose. So when it comes to January, all the reports are listed throughout the year, but if circumstances change and reports need to be moved, then they're moved further down or kind of joined onto other reports. So what you've got is the appendix in relation to what the status was as of the 1st of October. So the reports are scheduled throughout the year, but there might be some shift in that depending on what's happening for individual services. That kind of makes sense.
Excuse me, Mark, can you put on your mic, please?
Yes, Chair, I'll put on my mic. I know what I'd really like to do with the mic, but refrain from. But I'm still not seeing where the report is coming, or when is it coming?
Yeah, so what we haven't done, we haven't said when the report's been scheduled from in terms of the other months, and I can speak to Shirley about noting that. So yeah, all the reports where it says no reports moved later, they've all been heard, but we've not just cross-referenced back to the month that they should have been heard, if that kind of makes sense.
Thank you, Aaron. I've got Heather and then Bernie.
Yeah,
So thank you. Actually, my point was in relation to exactly what Martin has raised, and I was really going to ask for a bit of explanation on what it means. I looked at the first one and it says commissioned and registered services report required January 25. The next one, March, February. Does it mean that there's been no reports on any of these since January 25 or March, or is there a time scale that, you know, are they quarterly, once a year? That was my question. Thank you.
Thank you, Bernie. Was yours the same question or different? Okay.
Okay, yes. So what we've got here is a timetable of the annual reports that come to the Professional Care Governance Forum. However, on a bi-monthly basis, what we also have is the exception reports from each of these service areas as well. So they also have an opportunity to highlight anything on a 2-monthly basis as well.
Thanks, Aaron. Does that answer your question? Okay, thank you. Heather, now please.
My question relates to 3.4 on page 90 of 114 and the section that talks about the risks and how the risks have increased. The red risks have increased since the start of the year, Aaron. Obviously, there are mitigations in place to deal with these risks, and I can see that from the text that's there. I suppose my concern when I read it related mostly to the bottom of the 3.4, the final risk relates to leadership capacity in older people's services with mitigations in place. And I would just like to understand if the mitigations that are in place are being successful, because this is key to moving forward. And there's also the other red risk, which relates to occupational therapy services, I think. So I just would like a wee update on how successful the mitigations are being, because are we going to be able to move these from a red risk down to amber, or will they go to green? Because leadership capacity in older people's services seems to me to be key in how we move forward with the whole transition of the service. So I would just like some assurance on that. Thanks.
Aaron?
Thank you. So what I can say is that risks are always kind of dynamic. So the risks that were there at the beginning of the year aren't necessarily the same risks. They are kind of changed throughout the year, as you're right, as we de-escalate them. What we do as a forum is that we're really kind of quite mindful that if the risks aren't shifting, or if they're remaining as is, and we're not getting the assurance that anything is kind of really kind of happening around that, Hamish and I have an opportunity to escalate those to the Health and Social Care Partnership senior management team for a fuller discussion, just to kind of unpick those risks and to understand from a strategic management perspective in terms of what's happening. So in terms of the two risks that you identified, one in terms of management capacity, that was in relation, my understanding, to a post holder. Sorry, Amanda, do you want to come into that one? Yep, far better.
Thank you, Aaron. I think in relation to the leadership risk, we've made some significant improvements around that risk, and we have actually downgraded it. Without getting into too much operational detail, we've just rearranged the leadership capacity that we do have. It remains challenging, but we are reviewing that risk on a monthly basis, and it is ongoing. Do you want me to come in about the AHP risk as well, the OT one? So in terms of the OT risk, again, that is almost coming to an end. We've put in mitigations around that. We are in a period where we have recruited to the gaps that we did have in the service, so that risk from the health side will be coming to an end within the next month or so.
Just to say, I ask these questions relating to the risks there that are red from the 1st of October, because I'm triangulating with the earlier performance report. It talks about increases in absence, etc. And obviously leadership in a service is critical in order to try to avoid other issues that happen within that service. So I'm pleased to hear that that's been actioned, and that there are new arrangements in place. So thank you for that.
Thank you both. And Bernie, you have another question?
the OT service, because I know back last year I had raised some concerns about the waiting times for people in the community. So where you're saying that now hopefully this has been resolved, is that for hospital-based care, or is that an improvement that will also reach out to those in the community that are waiting for OT services? Thank you.
Let's take that. Amanda.
Thank you, Chair. Thank you for your question. I think it's obviously very relevant to our progress. In terms of the waiting times, we're still progressing, and there's two separate risks on the system. One is in relation to workforce, which is where the one that I've just alluded to. This is a separate risk, and it is being covered as part of a transformation programme under the HP direction of travel. Does that answer your question?
Yeah.
Thank you.
I don't see any other. Jackie, you want to come in?
Yeah, but it was really just to say that there's Leslie Middlemas, who's the lead AHP, is not with us today. She's actually not very well, and she would have been able to give you some more detail on that. But there is a piece of transformation underway in relation to the particularly around OT, but also physio in terms of the AHP support across the partnership, and Leslie's coming forward with some recommendations about strengthening that. Thanks.
Thanks, Jackie. Hamish, you want to come in?
Yeah, I was just going to say the same thing in terms of the transformation work undergoing with the OTB work, but also just to give the committee assurance that we've reviewed and significantly changed the way that we manage the risks. So we're much more proactive as a committee. So leadership meet with the risk owners on a monthly basis now, of the red risk owners, and we go through the risk and how it's being managed and what mitigations in place. And we've taken that out of the monthly governance forum, just so that we've got much more time and much more ability to scrutinise that and support that process.
Thank you, Hamish. And Valerie?
Yeah, just to follow up, and Hamish, as Hamish says, we've been doing a lot of work around the risks. Actually, since this report was actually written, we're down to one red risk now, and that's a postural care one. All the rest of them have been downgraded to amber.
Thank you, Valerie. I don't see any other comments, but I think I'm interested in Heather's reference to triangulation. Sandra, you have a comment?
Yeah, thank you very much, Chair. I'm not really feeling that the dynamic nature of the risks that are being discussed are being conveyed appropriately, really, to the committee. I don't think the actual current status and how they've changed is really represented within the report as the discussion has progressed.
Thank you. Can I just maybe make a comment on this generally? The strategic risk register does come before this committee about twice a year, and I think the next one's due in February. But perhaps based on the questions that have been raised here, we might want to think about, not just for this report, but perhaps for others as well, if there are significant risks that have, not been addressed in the timescales that are expected, or perhaps ones that need to be raised to the committee. So even if for awareness of nothing else. So perhaps that's something we can take away, officers, and include a little bit of, and as many of the reports as appropriate to this committee, what the significant risks issues are, not the full risk register, but things by exception, anything that's perhaps become more at risk, or things that have improved, which would be perhaps in the strategic performance report as a positive, but equally things that are challenges, just so we know. Would that help address some of the issues that have been raised just now? Yes. Okay, I'm seeing lots of nodding heads, so that's good. So we'll take that away. Aaron, did you want to come in? Jackie?
Yeah, really just to ensure that the committee's aware that we're talking about operational risks very often at team level. And we've got a piece of work underway because, for example, if you have a team where you might have 5 people and you have a staff absence, that feels like it's a very difficult thing to manage. So it can come through as a red risk. So I think the piece of work that's underway, and I don't know if Aaron or Hamish want, or Valerie, who's online, want to say something about this, is ensure that we've got a consistent approach across teams, because it's not consistent at this point in time. We know that it's not, and that actually that this is being kind of calibrated in a way that then transpires in a consistent format for us to have that overview. Thanks.
Thank you, Jackie. Is there any other comments? I don't see any other comments. So can we agree to the recommendations in this report? There's fewer recommendations in this particular one, but I'll go through, they're longer. The Audit and Performance Committee is asked to note the contents of the annual assurance statement in respect of clinical services delegated from NHS Tayside and social work and social care services delegated from Perth and Kinross Council to the IJB and delivered through the Health and Social Care Partnership. To note the level of assurance provided by the CPGF, which is to the Health and Social Care Partnership Audit and Performance Committee, NHS Tayside's Clinical Governance Committee and Perth and Kinross Council Scrutiny and Performance Committee in relation to delegated services, and that these have been accepted by each of these committees throughout the reporting period. And to note the Clinical Director and Chief Social Work Officer's overall statement of reasonable assurance for the reporting period. Can we agree to all of those notes? Thank you very much, everybody. So that brings us to the end of the business for today's meeting. You have also, for information, a copy of the Audit and Performance Committee annual report that was agreed by the IJB on the 20th of August. And we have the committee work plan for 2025-26 attached. Is there any need or anybody want a private discussion at the end of this meeting? Okay, well, in that case, just leaves me to thank everyone for their attendance today and to remind you all that the next meeting of this committee is Monday, the 23rd of February, 2026 at 10:30 a.m. Thank you. Thank you, everyone.